The upside. If they succeed, Stardust could become a key player in the US battery supply chain. The downside? Failure to execute could mean total loss. Watch for project milestones, financing updates, and government backing. This is not for conservative investors. If you want exposure to the battery revolution and can handle risk, Stardust is worth tracking. Otherwise, stick to established lithium producers. Stardust is a moonshot, big potential, big risk. Next, let's dive into biotech with Sonnet. The stakes get even higher. Here's what you need to know. Sonnet Biotherapeutics is a clinical stage biotech developing new cancer therapies. No approved products yet. Their value lies in their drug pipeline and proprietary delivery technology. Success depends on advancing drug candidates through clinical trials and eventually winning FDA approval. A single successful drug can be worth billions, but most candidates fail in trials. Stock prices swing wildly on trial results. Positive data can send shares soaring, negative news can crush them. Financing is a constant challenge, clinical trials are expensive, and dilution is a risk as new shares are issued. Always check their cash runway. How long can they operate before needing more funds? Regulatory hurdles are high, and even promising drugs can be rejected or delayed. Sonn is a pure speculative play, betting on science, management, and a bit of luck. The upside, a breakthrough, could mean massive returns. The downside, failure, could wipe out your investment. Only invest what you can afford to lose and understand the science and risks. Sonn is for high-risk, high-reward investors, or those allocating a small portion to speculative biotech. Watch for clinical milestones and funding updates. If you're not comfortable with volatility, steer clear. For those who thrive on risk, Sonn is a biotech lottery ticket. Next, let's look at medtech innovation with Monogram Orthopedics. Can they disrupt surgery? Let's find out. MGRM, Monogram Orthopedics, is developing personalized joint implants using robotics, 3D printing, and AI. Their goal: custom-fit knee and hip replacements for better outcomes and faster recovery. They're building a robotic surgical system to precisely fit implants to each patient. Still in development, Monogram is pre-revenue and burning cash on R&D and regulatory approval. The market for joint replacements is huge and growing with an aging population. If Monogram's tech proves superior, they could disrupt a massive industry. The upside: better patient outcomes, recurring revenue from custom implants, and potential rapid adoption. The risks: regulatory hurdles, commercialization challenges, and entrenched competition from giants like Stryker and Johnson & Johnson. FDA approval is a major barrier, and convincing hospitals to adopt new tech is tough. Monogram must prove their system is not just better, but significantly better. Success could mean huge growth, failure could mean